Hello, welcome to this presentation on eliciting active participation to promote recovery after stroke. This presentation is about engaging and empowering our stroke patients to help their functional recovery. I am Shamala, a physiotherapist, and I'm presenting this lecture with my colleague Nurse Zichin. The objectives of this presentation is to briefly highlight the evidence supporting the need for all of us to work together to encourage our stroke patients to be more active. We will also be recommending strategies that doctors, nurses, allied health and caregivers can use to increase activity levels of our patients. There is evidence demonstrating that early and frequent engagement in activities can promote motor and functional recovery after stroke. There's emerging evidence to show that a stimulating environment in hospital that increases physical, social, and cognitive engagement can also increase activity levels and promote recovery. During the preparation of this presentation, Zichin and I shared our clinical experience. Most of our stroke patients spend a large part of the day in bed and not involved in any activities to help their recovery. Zichin shared that her patients also tend to adopt a passive attitude and expect to be helped. Similarly, research in stroke units in other parts of the world investigating activity levels found that stroke patients tend to spend more than half the day resting in bed. Only 13% of the day is spent engaging in activities that help to improve their mobility and prevent secondary complications. Patients also spend a large part of the day alone. Engaging the stroke patient actively in daily routine provides them with extra opportunities for practice. Increased practice of an action results in improved skill acquisition. This is defined as task-specific practice or functional task practice. Examples of this in rehabilitation is training getting out of bed, standing up from sitting, and walking practice. So how much practice is required to optimize function? That's the million-dollar question. We need more dose-response studies in rehabilitation. An exercise dose cohort study by physiotherapists in inpatient rehabilitation in a unit in Australia found that for every additional 100 repetitions of lower limb exercise, the patients can walk faster by 0.08 meters per second. We need further research in this area similar to this before we can answer the question of how much is enough.
In the recently completed ADVERT RCT, intensive very early mobilization protocol within 24 hours was associated with a reduction in the odds of a favorable outcome at 3 months. Thus, there is a strong recommendation against intensive out-of-bed activities within 24 hours. However, there is strong recommendation to start out-of-bed activity within 48 hours of stroke unless contraindicated. A strong recommendation as per the guidelines essentially means just do it, and there is good reason to believe all informed patients would want this option. The recent stroke guidelines also recommends that it is good practice for stroke survivors to continue practice outside of scheduled therapy time. Good practice statements represent the guideline panel's view of optimal practice, but are not graded. Panels should use good practice statements when high-quality indirect evidence is available, but it will not be a good use of the panel's limited resources to conduct formal evidence summaries.
Engaging and empowering our stroke patients to participate in routine self-care and mobility activities outside of therapy will encourage independence and improve the patient's self-efficacy. Focusing their awareness on the task has been shown to activate the motor cortex and again helps with functional recovery. This also provides an opportunity for practice outside scheduled therapy sessions. Therefore, a team approach is needed to engage our stroke patients in activities throughout the day. Every active movement and repetition counts.
Now I'm going to share some strategies in engaging patients. Before engaging patients to start the activity, you can use an assessment on their alertness and ability to obey commands. For instance, can you lift your hands up? Or can you help to turn to your side? After assessment, Provide simple instructions and try to engage patient in the activity as much as possible. Try to wait for patients to respond to the action needed before proceeding to the next instructions. Below, there will be 2 short videos demonstrating on turning and sitting patient action by the nurse. In the video, you can see the nurse introduce herself and explain to the patient on the activity that she's doing. This is to let the patient be aware of the things done so that it is easier for them to cooperate during the process. The nurse will do an assessment by assessing the weaker side of the patient, which is on the left side of the body, and how she can engage the patient during the process. Simple instructions is given to patient like, can you try to lift your left leg as much as possible? And can you move your left hand onto the rail? To wait for patient to respond before heading to the next instructions. Verbal cues like ready, 1, 2, 3 to prepare the patient in turning. This picture shows the hand position and posture of the nurse during turning and letting the patient initiate the movement as much as possible. In this video, you will see the nurse explaining the action and providing simple instructions like, can you try to lift up your left leg as much as you can? The nurse will assist to patient's limit. And can you move your left hand onto the rails? The nurse will turn the patient to her side using simple verbal cues. She encouraged the patient to move her leg towards her, and she helps the rest. Do take note of the hand position on the nurse in the video. She also tried to engage the patient as much as she can by using ready, waiting for patient to respond, and 1, 2, 3 to start the motion. From this slide, you can see the hand position of the nurse placed on patient. One of the hand is placed behind the shoulder and the other on the hip area to enable easy sitting up. It also supports and assists the patient at the same time when they do not have strength during the process.
In summary, there is evidence to support that frequent engagement in activities promotes functional recovery after stroke. However, we know that our patients spend most of the day inactive and alone. Therefore, engage and empower our patients because every active movement counts to promote functional recovery after stroke. Thank you.